Hello there and welcome. My name is Dr. Lopes with MP Exam Code. On this training, Module 1, training number 9, it is all about the neurotransmitters, right? What do they do? Where are they located? How they are produced? These are all important information that you need to know for your PMHNP board certification. So let's get right into it. This is our roadmap. We are on training number 9, and it's about neurotransmitter, a guide for the PMHNP board prep. Here they are, right? In summary, starting with a summary, when you think of acetylcholine, it should lead to memory, okay? Keywords memory, dopamine, the keywords is pleasure, rewards, right? For the addictive. Epinephrine, norepinephrine should be your fight or flight. Okay. So, how about GABA? GABA, it calms you down. That's your chief inhibitory neurotransmitter. GABA calms you down. Your glutamate, you're all over the place, right? So, glutamate activate you. Activate or excitement is your glutamate. Then, lastly, we have our serotonin. Serotonin is your feel good, is your mood neurotransmitter. Obviously, this is just a very simple concept here, made very simple, and we are going to discuss it in more detail now. So let's start with the serotonin. The mood is for serotonin. So when we say the serotonin, when we talked about the serotonin, it's very important to know where it is produced. It is produced in the Raphael nuclei of the brain. Okay. Serotonin is produced in the Raphael nuclei of the brain. It's associated with the sleep and mood. Think of a serotonin for well-being and mood regulation. When you have an increase in serotonin, right, you could lead to serotonin syndrome. The lack of or decrease can lead to depression, obsessive compulsive disorders, and anxiety. No wonder the SSRIs, the SNRIs, they're all good for those three conditions just mentioned, right? We can use them for those three conditions. Now, serotonin again, made where? Raphael nucleus. Primarily regulates what? Mood, anxiety, sleep, and appetite. Think of this as head, red, fed. The head means satisfaction, migraines, moods, sociality, decrease impulsivities, decrease anxiety, and decrease sex drive. The red is mean the serotonin could cause a pilot binding, which means bleeding, right? And the fat is your GI motility. If you think about the Zoloft is known to cause a GI motility and nausea. Now, when it comes to serotonin syndrome, think about head, red, and dead. So the patients would have too much serotonin, leading to headache, agitation, and confusion in the head. The red is mean hyperthermia, hypertonia, right? Increased flexibility, sweating, and tachycardia. And dead, which refers to a mortality rate of 2 to 8% of those with the serotonin syndromes. I need you to really, really memorize the serotonin syndrome because it's an important concept. Usually, test makers like to confuse serotonin syndrome versus NMS, which we'll cover in a little bit in the upcoming modules. However, when you hear serotonin syndrome, I want you to memorize this acronym, the S's. There are two S's, two high, two DIs, two H's, two muscle, and a tick. Can you memorize that? Two S's, two highs, two D's, two H's, two muscles, and a tick. So the two high means the high heart rate and the high blood pressure. The two DIs mean diarrhea and diaphoresis. The two H means the head, head and hallucination. The two muscle means muscle spasm and muscle rigidity. Okay? Not as much as NMS, but you still have muscle rigidity. The T is for tremors, the I for irritability, the C for confusion, and the other C is what you give to the patient. Cryptoheptadine, or you can use benzos as well. So the two S's, two high, two D's, two H's, two muscle and a tick is what you need to memorize. Now, understand what you give for serotonin syndrome, cryptorhatidine. How is it different? You have to know how is it different than NMS. One of the difference is the muscle spasm, right? They have muscle spasm or seizure like clonic seizures, right? It could have clonic seizures. And the muscle rigidity here is not pipe led like NMS. So watch out for questions that will trick you between both symptoms. The dopamine, on the other hand, it increases a sense of well-being, sanity, and decreases hunger, cravings, and associated with rewards. It's produced in a substance niger, nucleus accumbens, the ventral tegmental area, okay, associated with motor movements. Where it is produced, it's produced in three locations: substantia niger, nucleus accumbens, ventral tegmental area. So dopamine is produced in three locations. Mnemonics, very tired addict for dopamine role in addiction and reward. So if you have too much dopamine, what does it happen? You will have a psychosis like symptoms, right? Part of your mesolimbic pathway. If you have too little serotonin, you would have Parkinson disease like symptoms, right? Because of the decrease in dopamine and a increase in what is the inverse relationship of dopamine and okay, I hope you get it. Okay, you have a dopamine. So just remind you, in a nigrostriatal pathway, you have a decrease in dopamine and a increase in acetylcholine, right? So if you have too much dopamine in the mesolimbic, you have psychosis. If you have too little dopamine in the nigrostriator, you have those conditions like Parkinsonian symptoms, motor symptoms due to the increase in acetylcholine. Now, again, it's very important to know where dopamine is made and the ventral tegmental area for very tired addict. It's your drive, psychosis, Parkinsonism, attention, motor, inhibition of the prolactin, right? Remember, dopamine have an inverse relationship with prolactin. Dopamine have an inverse relationship with acetylcholine, depending where they're located. So if we're talking about prolactin, we are referring to the tubulofundibular pathway. So if you have an inhibition of prolactin, was known as prolactin inhibiting factor, initially, right? So you don't have those symptoms that we described, such as osteoporosis and so forth. Okay. So it also has to do with narcotic because the narcotic release dopamine for pleasure, right? So you would now want to give something that release dopamine for psychotic patients, like stimulants would increase dopamine, right? The extrapyramidal side effect. So if you block dopamine, you could potentially have those side effects that we cover in detail by now. How about the norepinephrine? Well, norepinephrine is another important neurotransmitter. It is responsible for increasing your heart rate, alertness, well being, decreased pain sensitivity, and circulation. It is produced in the lucus coeruleus and medullary reticular formation. Norepinephrine is produced in the lucus coeruleus and the medullary reticular formation. One example of norepinephrine would be the fight or flight neurotransmitter for alertness and increase in heart rate. So, what would happen if you have too much norepinephrine? You would have alertness to a point of anxiety, and too little of it would be something more likely of depression, right? So, depression and anxiety is not only dopamine, it has norepinephrine and serotonin, norepinephrine, and dopamine. So norepinephrine, it's made in the lucus coeruleus, right? And we said also in the medullary reticular formation. Think of norepinephrine as the primary regulation for executive functions, mood, arousal, cognitive functions, uh, your increase in heart rate, the peripheral tachycardia, hypertension, and glucose release. So, how about acetylcholine? We said earlier that acetylcholine is very important for memory, but it also increases your heart rate, your secretions, sweating, salivation, memory, and muscle contraction. It is made in the nucleus of Maynard. Whew, that's a hard one for me. Look, the nucleus of Maynard. Okay. An example of this is ACH makes your heart race for its effect on the heart. Too much of it, you would have what? Parkinsonia. In what dopamine pathway? Nigrostriatal. Decrease in acetylcholine, right? You would have dementia like symptoms. Okay. So, once again, the roles in oculomotor and autonomic nervous system is important, and where it is made is important. So, GABA is the chief inhibitory neurotransmitter. It increases sleepiness, decreases of anxiety, decrease alertness, memory, and muscle tension. One mnemonic to remember is GABA grab for its calm effects to help in the idle chat. So it's very different than glutamate. Glutamate is the chief the chief um, excitement. GABA is the chief in calming down. Okay. So if you have a decrease in GABA, if you have a low GABA, would lead to anxiety. Okay. If you have For example, benzodiazepine binds to the GABA receptor to potentiate the isolytic calming effect of GABA. Again, chief inhibitory neurotransmitter, relaxation, decreased breathing, muscle relaxation, no anxiety, no seizures. So does it make sense why when one drinks a lot, they need a benzo to compensate so they don't have seizures? So the benzo is to increase the GABA anxiolytic effect, thus preventing seizures. Glutamate, on the other hand, is the chief, most abundant excitatory neurotransmitter. Most abundant excitatory neurotransmitter. It increase level of glutamate, increase anxiety levels, right? So think of it as a glue test for excitatory effect causing anxiety. So its associated pathology, it would be with the increase in psychosis. So increase in psychosis is mostly talked about dopamine, but it also has uh, glutamate involved. Okay, so increase in psychosis, mood liability, and seizures, especially seizures, really, and the decrease in impaired memory and negative effects. So glutamate, the most abundant neurotransmitter, well over 90% of synaptic connections in the brain, involve the most aspect of normal brain function. It is excitatory, learning, memory, works directly and in volume neurotransmission. Okay, we cover what's volume neurotransmission in our PMHNP Psychoform course. Definitely, after you pass this board, you should check this out. So, increased level of glutamate affects the corticotropin releasing hormone in the amygdala, hippocampus, and locus coeruleus, increases the symptoms of anxiety. Okay, important. That's important to know as well. All right, just a real recap here. You have your adrenalines or norepinephrine, epinephrine, fight or flight. Your GABA is calming. Okay, your noradrenaline would be your concentration. Your acetylcholine, you need that for memory learning. Your dopamine, it's about addiction and pleasure. In the real world, glutamate, it's about memory. Serotonin makes you feel good with your mood, and your endorphins, which is the medications that release during the exercise or pain relief, right? Your endorphins feel good, but also when exercise, um, excitement, or sex, producing a well-being and euphoria-like feelings, right? That's your endorphins. Now, checking on learning, which brain region is the majority of serotonin, a neurotransmitter associated with sleep and mood regulation, produced? A. Raphael nuclei. B. Is it the nucleus accumbens? Or C. Lucus coeruleus? Or D. Amygdala? Well, if you answer A, you are right. Since we are on this subject and it's very important for the board, let's review this in more detail. Serotonin producing a Raphael nuclei located in the brain stem. Okay. B, the nucleus accumbens. It's part of the dopamine where the dopamine is produced, right? And it also has to do with the rewards and motivation. It mainly releases dopamine, not serotonin. The lucus coeruleus is for norepinephrine. The lucus coeruleus primarily produces norepinephrine, a neurotransmitter involved in the stress response and arousal. How about the medulla? Medulla is associated with emotions process and fear. Fear of smell. It processes the in the medulla is a response, but is not primarily responsible for serotonin production. So those options are distractions. And just like that, we cover module 9. Let's move on to module 129. Let's move on to our next module.